Hello, my name's Elizabeth Gomez. I'm delighted to have been invited today to speak to you about generating a sense of coherence in an international midwifery educator curriculum. So, across the world, every day, approximately 800 women die from entirely preventable causes related to pregnancy and childbirth. And just to contextualise the situation in India, with regard to mortality, despite continuous progress, nearly 32,000 women die a year in India throughout the pregnancy continuum. And according to Statista in 2019, there were 28.3 neonatal deaths per 1,000 live births. However, it must be acknowledged that there was progress made because a decade before, in 2009, that figure was 47.3. Evidence suggests that there's a significant correlation between the care received during pregnancy and childbirth and the survival of women and babies, and that quality midwifery care delivered by those educated to international standards considerably reduces maternal and newborn mortality by 83%. In India currently, there is no training programme taught by professional midwives that complies with the internationally recognised competencies and teaching durations set by the ICM. There's no separate registration, standards or guidelines, no preceptorship programmes to ease that transition from student to qualified midwife. There are no specific job responsibilities or delineated roles, hence no midwifery integrated care. There's no guarantee that when trained, they will be recognised as professional midwives. And the lack of exposure to midwifery has led to a mistrust of other healthcare professionals who do not recognise midwifery as an autonomous profession. In 2019, the Government of India, funded by the WHO, commissioned the Fernandez Foundation to provide a cadre of international ICM-compliant midwifery educators that would be sufficiently competent to train and be professional midwives, thereby addressing some of these issues. The Fernandez Foundation, of course, our co-host for this event, had already commenced the training of student midwives in 2011 with their PMET course, Professional Midwifery Education Training course, and were therefore ideally placed to embark on this WHO-funded project. The Fernandez Foundation approached Professor Sue Down at UCLan to assist in the designing of the curriculum, the development of resources, and the recruitment of experienced midwives who will be trained as the first cohort of international midwifery educators. And I was appointed education lead for the project. So just a quick look at UCLan. We had two research streams, Reach and Main. So Reach ran by Professor Sue Down, which is research in childbearing and health, and by Professor Fiona Dykes, the mainstream, which was maternal and infant nurture and nutrition. They've now come together and formed Thrive, which is transdisciplinary health research for thriving in the early years. The education team work in tandem with the research team, and it was therefore natural that when the Nursing and Midwifery Council in 2013 came to revalidate our programme, we had adopted a philosophy of salutogenesis, coined by Aaron Antonovsky in 1979, that I'm sure most of you will be familiar with if you've heard Sue talk over the years. And the development of a case-based learning curricula was a perfect framework on which to structure this. Our case-based learning curriculum has evolved since to include more blended learning approaches with core learning activities, recorded teaching sessions, live lectures, and so on, the benefits of which were particularly apparent as we, along with most other universities, had to move to an almost exclusively virtual teaching platform throughout the current pandemic. Just to mention the National Student Survey, this takes place every year for every graduate. So in every university for every course. And we were fortunate this year and delighted to have come top in all teaching and learning. So we attained 100%. So just to look a little more closely at a salutogenic orientation to care. So this represents an approach that's moved away from the traditional pathological paradigm of dichotomizing normal to abnormal and low to high risk, and perceiving birth more on a continuum. We know that the medical approach to maternity care still exists in many areas across the world, and they seek to determine the origin of disease and disorders to a condition. So, for instance, you probably heard of women referred to as that diabetic lady in room 1, or twin lady and so and so. So salutogenesis considers the woman as a whole and her family and the environment that surrounds her. The curriculum is designed to ensure that learning, skill development and care delivery are focused on the promotion of health and well-being, irrespective of classification of risk assigned to the woman, or the baby and family, and that both education and practice are sensitive to the socio-cultural context of all individuals concerned. The programme is supported by an ethical framework which reflects the rights of women and promotes moral and ethical values such as respect, advocacy, confidentiality, professional integrity, and personal autonomy. In order for individuals to develop a sense of coherence, consideration has to be given to 3 components. Comprehensibility, so that's a cognitive aspect and refers to the extent to which you might perceive both internal and external stimuli as being understandable in some kind of rational way. Manageability, which is a behavioural aspect, is to do with the degree to which we might feel that there are resources out there at our disposal, so coping skills. And meaningfulness is a motivational aspect and has to do with the extent to which we feel that our lives have meaning. So just to look now at the features of case-based learning. So really this is just to compare with the traditional approach, which is more of a didactic type teaching where the teacher is speaking at the students with limited interaction. Or on the other hand, we have case-based learning, which is a group-led approach. So everybody has input, equal input, along with the lecturer who sits in on that as well. And the case-based learning structure, so just to go through, the students are presented with a case perhaps at the beginning of a week, and it's either an ongoing case or a new case, and it's revealed to the group, and individual tasks are assigned. They may also have a core learning activity, which could include a class discussion, lecture, workshop, or some sort of simulation. And students work on the cases individually or as a group. Feedback is usually to your own group, but more often than not to the group as a whole. And then reflection, peer and facilitator takes place, and feedback is given to each individual presentation. This is a case that we developed for India around respectful maternity care. So this is Rupa, who comes to a public health clinic with Tariq, her husband. Rupa had previously had not a very nice encounter with her last pregnancy. She's a prima gravida, and this is her second pregnancy, multigravida, and this is her second pregnancy. And she really wanted Tariq to be with her. Unfortunately, this was refused. I can't read out the whole slide, but this will be available to you after the presentation for you to go through at your leisure. This is just demonstrating some of the ways in which the students feed back. So they might design a leaflet for a woman or the family or videos. They might decide to feed back doing a PowerPoint or Prezi or similar presentation. And also there's very creative examples, which usually they develop a game or something like that, whichever way they feel best. So this is just looking at the International Midwifery Educator curriculum. So how we've supported them. So initially they were sent some pre-course activities in the form of a Microsoft Sway that they needed to work through, which looked at global initiatives and teaching and learning resources. They had to complete that before they came for the residential week at UCLan, where they were taught professionally by the midwives, midwifery lecturers, research team, by other members such as health visitors, and the Centre for Excellence in Learning and Teaching, where they were taught the educational element of the course. When they went to India, they then had weekly coaching action learning sets. So we met with them and gave them a task. So it could be developing perhaps a case, or developing a core learning activity, and it could be something to do with the curriculum. So teaching lesson plans, things like that. Sharing case-based learning approaches and resources from UCLan throughout. And visits followed by ourselves to India for observation, support and assessment of the IMEs. Here you can just see some feedback from students on case-based learning. So this is around collaborations, so either active or in respect of us looking at competencies and guidelines and embedding that within our curriculum. So we also looked at global initiatives, very importantly, the Lancet series and so on, and those you will see when we mapped the competencies. So we decided on 3 themes: communicating midwifery, becoming and being a midwifery educator, and leading and evaluating midwifery education. I'm just choosing one, being and becoming and being a midwifery educator, and just to demonstrate here how we mapped the wider competencies and frameworks, and you can see them across the top there. And then this continued throughout. So when we're looking at curriculum development and design, teaching and learning theory and practice, assessment and feedback in theory and practice, and creating learning environments, you can see that all of those competencies are mapped throughout. I just briefly want to talk to you about Amy. So Amy was a midwife from the UK who went over at the end of 2019 to join the IMEs that were already there. And this is just an example of her giving a core learning activity. So she's actually doing a PowerPoint at this time. And these are the midwifery educators here who are listening. And then looking at the case-based learning, they're assigned a case, and they then decide on which roles they're going to take. And you can see Amy supporting them here, and then them undertaking working on the case. So what happens here is that they're all assigned a different element to explore. So it could be the physiology. If we take Rupa, for instance, what's happening to Rupa? She says 8 weeks pregnant, so what's happening physiologically for her? Or for the baby, somebody else will do the baby. Somebody will look at the evidence and research around practice and what's current. Somebody else will look at the midwife's role in all of that, and so on. All assigned a different role. So the IMEs also go out into the clinical area with the students and support them teaching and looking after women. And you can see here, this is a clinical coaching where Amy is coaching one of the midwifery educators who is teaching some Indian ladies around positions that they might like to adopt in labour and the importance of keeping mobile. The IMEs, the impact the IMEs had. So they developed and delivered a curriculum based on INC, Indian Nursing Council, and ICM education standards, introduced a salutogenic philosophy of case-based learning, supported and educated 30 MEs and 60 nurse midwifery educators, 1606 that was, delivered theoretical and clinical education, coordinated rotas, and were involved in quality mechanisms. And throughout all of this, very importantly, they embedded respectful maternity care. These are the researchers at Fernandez who evaluated the project throughout. And this is just some of the feedback. So which methodology was useful to the trainees, and case-based learning came top, which we were delighted about, that they had embraced our philosophy. So here is just showing the inauguration of the Midwifery and Nursing Training Institute at the Fernandez. And we were delighted this year to have won the Excellence in Midwifery Education and Research Award, awarded by the Royal College of Midwives. And we've also been nominated for 2 further awards, which are pending. One's around innovation and the other about interprofessional and international collaboration. So I'm sorry about that very rushed presentation. There's some more resources here for you to see, and the references will be on the presentation when you look through. Thank you so much.